Anxiety medication. That is our group project that we are doing. With anxiety medications, it's important to understand about anxiety and the disorders that come along with it. Anxiety is an uneasy feeling of discomfort and dread that's associated with the autonomic response. That response is also known as the fight or flight response. So when you get anxious, your body involuntarily has an abnormal reaction that you can't help. And you want to fight or flight, run away or, beat the person up. Anyhow, so with that being said, anxiety disorders, when you get real anxious, you'll have panic attacks, irrational fears, muscle tension, sleep disturbances, fatigue, and excessive worrying. With anxiety disorders, there are a lot of different anxiety disorders. Not all of them need to be treated with medications. Most anxiety disorders are going to be treated with a psychotherapy, which is talk therapy, and different kinds of therapies that are used, especially with anxiety disorders and obsessive compulsive disorder as well. It's this cognitive behavioral therapy and the exposure of the response there with the response therapy. These therapies are usually done first, and they can be done with or without medications to help with these anxiety disorders. So the first line of defense, and the first, basically when I say first line of defense is what as a doctor is going to prescribe more often than not when we're dealing with all these anxiety disorders is going to be an antidepressant. They will either probably prescribe an SSRI or an SNRI. SSRIs are very popular. When we talk about antidepressants, we want to discuss serotonin levels. So serotonin is a neurotransmitter that's in your brain, and it affects your mood, your sexual desire, your appetite, your sleep, your memory. So when your serotonin's low, you can be depressed or really thrown off your game, sad, moody, all that. So we are trying to increase our serotonin levels so that we can get back to normal. With antidepressants, it could take 4 to 6 weeks to produce noticeable effects. There's a risk of bleeding when you use them. When you use antidepressants with other drugs that may have a risk of bleeding. You also need to be careful with bipolar patients taking antidepressants. You want to be careful with the serotonin syndrome because a lot of times you may have two medications that have serotonin, like buspirone or Buspar is often prescribed with these antidepressants. So you have to be careful with serotonin syndrome. Patients under 25 years of age, we want to be really careful to monitor them for suicidal thoughts and behavior. And what's really important is we do not want to stop taking antidepressants abruptly. We want to taper off over 2 weeks period of time or more. It's called the discontinuation syndrome. It's dangerous. It's not something that you want to do. Also with antidepressants, you normally want to try to take them for 6 to 12 months. You're always going to start at a low dose and gradually increase. So when we talk about antidepressants, we have SSRIs, SNRIs, TCAs, and MAOIs. So SSRIs, they're going to increase your serotonin activity. Normally, when I hear about SSRIs, I always hear Lexapro, Prozac, Zoloft, Paxil, Celexa, but in nursing school, we are trying to learn the generic brand names. So that's escitalopram, fluoxetine, sertraline, paroxetine, and citalopram. Side effects of the SSRIs, there's a lot of, I can't quite say it right, allocarogenic. Anyway, side effects that have to do with SSRIs: nausea, vomiting, diarrhea, headache, drowsiness, dry mouth, insomnia, nervousness, agitation or restlessness, dizziness, sexual dysfunction, impact on your appetite, weight loss or weight gain. So the biggest one right there is the sexual dysfunction that people are always worried about, and probably weight gain. Anyway, so next we're going to talk about the serotonin norepinephrine reuptake inhibitors. They work by increasing the amounts of serotonin and norepinephrine in the brain, and that helps maintain mental balance. The two main medications we talk about with the SNRIs are going to be duloxetine and venlafaxine. The duloxetine is Cymbalta. It's used to treat generalized anxiety disorder, panic disorder, OCD. Want to be careful if you have any liver problems. It could worsen them. Venlafaxine, Effector, has a long-term treatment for generalized anxiety disorder, social anxiety, panic disorders, and obsessive compulsive disorder. It can raise the blood pressure in a patient as well, so you need to monitor that. Side effects include nausea, dry mouth, dizziness, headaches, excessive sweating, sexual dysfunction. So next we're going to talk about tricyclics and how they block the reuptake of serotonin and norepinephrine, and they work similarly to SSRIs. Tricyclics have been around since the 50s, so they've been used a lot. They are not used nearly as much anymore because there are other medications that just have less side effects that are being used these days to treat anxiety. They work for most anxiety disorders. Clomipramine is really good for OCD and panic disorders with agoraphobia. Mipramine is very good for panic disorders. Some of the important tricyclics or TCAs are nortriptyline, doxepin, clomipramine, imipramine, and desipramine. Side effects include dizziness, nausea, vomiting, constipation, blurred vision, weight gain, cardiovascular effects. We have the MAOIs, which are monoamine oxidase inhibitors. They are not used very much anymore because they are dangerous. They have really adverse side effect. Well, they have really contraindications when they're taken with drug interactions and with food drug interactions. So avocados, red wine, aged cheese can cause some very dangerous reactions, and also if taken with birth control pills or cold or allergy pills, ibuprofen, pain relievers. So this gets really, really dangerous, and it could increase your blood pressure and cause life-threatening side effects. Instead, we tend to use mood stabilizers like lithium. MAOIs are just really not used as much anymore. It's kind of a moot point because a lot of our drug contraindications are included when you're using MAOIs. So luckily, we don't have to worry about that as much. Next, we want to talk about, so that was all the antidepressants, which was SSRIs, SNRIs, TCAs, and MAOIs. And now we are going to move to a different medication class, which is, it has its own thing going on. It's called buspirone, and the medication is called Buspar. It is a great medication. It is used a lot. It takes up to 3 weeks to work sometimes. So we would use hydroxyzine for immediate relief, which is an antihistamine, while we're waiting for the buspirone to work. As far as the buspirone goes, it binds to serotonin and dopamine receptors. It's usually used with SSRIs a lot in combination with other drugs, especially antidepressants. So you want to be careful because when you have two medications that are using serotonin, we are at risk for serotonin syndrome, and it can be life-threatening and very dangerous. So You want to be really careful with that. The buspirone is a non-addictive medication, unlike benzodiazepines like Xanax. So that is great. That's one of the reasons why the doctors love the buspirone, is that it is non-addictive and it's not a benzodiazepine. So side effects: nausea, dizziness, headaches, nervousness or excitement. It's used to treat short-term relief of anxiety and generalized anxiety disorder. Let's see, side effects on buspirone are blurred vision. Oh, pardon me. Side effects on buspirone are dizziness, headache, nausea, nervousness, or excitement. Also, with buspirone, you want to avoid grapefruit juice. If you have a compromised liver or kidney disease, you want to be careful with that. Patients with diabetes, maybe monitor the blood glucose. Next, we're going to talk about benzodiazepines. They are in their own medication class. Benzodiazepines are very dangerous because they are a central nervous system depressant. They enhance the action of the GABA, which slows your neural excitability, which is why it's dangerous. So benzodiazepines, we hear about Xanax, Ativan, Klonopin, Valium all the time. Xanax, I don't know if it's really prescribed as much anymore because it's considered dangerous. The effects are especially pronounced in the limbic system, the thalamus and the hypothalamus. It is used for short-term treatment of anxiety. Nobody wants to prescribe it very long because it has withdrawal effects. After 3 or 4 weeks, you could have withdrawals. Also, it's got this very sedative and calming effect on the body, which can lead to people wanting to abuse the drug. So it's addictive. You can get a tolerance over time on it, so you have to keep increasing how much you take. And it's easy to overdose with Xanax and benzodiazepines because it depresses your central nervous system. So when you use alcohol or any other kinds of drugs or substances that have a CNS depressant, it's very, very dangerous, and you want to be really careful. Also, the side effects are sedation, dizziness, fatigue, impaired cognitive motor skills, and CNS depression. You want to be careful when you give any of these kinds of medications to our older population because of fall risks. So that's benzodiazepines. Next, we're going to talk about antihistamines. It's an agent that competes with the histamine for binding at the H1 receptor sites on the effector cell surface. It leads to suppression of certain subcortical regions on the brain. Hydroxyzine or diphenhydramine are two types of antihistamines that are used for anxiety. They relieve anxiety very quickly. They're non-addictive, and this is a doctor's first choice, until the buspirone or the SSRIs are working. So it's a great quick relief of anxiety, and it's non-addictive, so that's great. Side effects: they have this is the word I have a hard time with, anticholinergic effects, which is the dry mouth and the nausea and the dizziness and all that, and the constipation and urinary retention. It's definitely good to know because you can get a lot of effects in one word there. Headaches, unintentional trembling or shaking movements, and seizures are very adverse effects that could happen. So you need to be monitoring that. Next, we're going to talk about beta blockers. Beta blockers block the adrenergic receptors, particularly epinephrine, which is adrenaline. Beta blockers are an off-label treatment to treat social anxiety. Normally, beta blockers are used to treat heart conditions because beta blockers they make the heart beat more slowly with less force, which causes lower blood pressure. Contraindications, there's a lot of contraindications, multiple drug interactions, and multiple medical conditions that can cause beta blockers not to be a good fit for a patient. So the doctor will just have to do their diligence on that. Beta blockers can cause serious anaphylaxis, skin reactions, heart failure, changes in blood sugar levels can occur. Also, it can add to the effect of the CNS depressant. So you don't want to use drugs or alcohol with that because it can make the CNS depressant, increase it. Definitely don't want to be driving or doing handstands and taking any of these medications really without knowing how they're going to affect your body with time. Side effects of the beta blockers are dizziness, nausea, fatigue, and impaired sleep. When we talk about beta blockers, we're talking about propranolol and atenolol, and they're used for performance anxiety or stage fright and test anxiety. Last but not least, other medications that get used, there's an antipsychotic called ketapine, and then there's a GABA analog called pregabalin. You can check it out. They are just, some other medications that are sometimes used for anxiety disorders. As far as things you can buy over the counter at Whole Foods or Rainbow Blossom, we have herbs that people will use: kava kava, valerian root, lavender oil, or St. John's wort. Actually, I used to use valerian root to help me sleep when I was in college. I put a little bit in, like a little bit of orange juice, and take it when I woke up in the middle of the night. This is going to conclude our presentation on anti-anxiety medications, and hopefully you learned something.